The Human Rights Commission and the Department of Health have visited the Charlotte Maxeke Hospital following the recent fire there for inspection. There's been reports that some patients who are receiving chronic treatment at the hospital are struggling to get their medication. Management of the Johannesburg Charlotte Maxeke Academic Hospital have also denied that it failed to make plans for alternative treatment sites for cancer patients following the fire. The Human Rights Commission and the Gauteng Provincial Government are about to brief the media. We cross to that now.
We also wanted to assess the reasonableness of the interim arrangements that were made or have been made for existing and new patients. We also wanted, from a legal point of view, to ascertain the compliance of the hospital with the building and fire codes, regulations and standards. We had fruitful discussions with the acting DG, the acting CEO of the hospital, the acting HOD of Health, and the head of Department of Infrastructure Development in Gauteng. We were presented with the status of several interventions that government has undertaken over the last few weeks to ensure that this hospital can again be used by members of the public. Our overriding concern was the safety of the hospital staff, the safety of the facility in accommodating patients and users of the facility, because over the last few weeks we had received complaints from cancer patients in particular who could not receive oncology services at the hospital. Some were relocated to other facilities, and they said this was an inconvenience. They lamented the lack of communication, and we wanted to ascertain and establish from government if there was sufficient communication, where there were challenges, how they resolved these challenges. And our approach was really solution-oriented. We are satisfied with the interventions that the government has implemented thus far. We will continue to monitor this matter, because we are required in terms of the Constitution to also monitor the observance of human rights, and the Department of Health has a constitutional function of ensuring access to healthcare services. And we know, and I've said this previously when we visited other hospitals, that the healthcare system in Gauteng is jammed, and you can imagine what happens to the entire system when a facility as big as Charlotte Maxeke cannot be used by members of the public. There are departments which provide unique services, and there's been good work done by the hospital over the years in terms of providing services to oncology patients, to dialysis patients. And with the recent water outage at Helen Joseph, I can imagine the challenges that the health system is facing in the province. But I have the accounting officers from the relevant departments. We will continue to engage with government. We are going to also engage with the city of Johannesburg, which has to enforce its bylaws, has to ensure that all buildings adhere to their regulations. We'll also be engaging with the SAPS, which is tasked with investigating the circumstances that led to the fire, to establish those, if there is anyone who can be held responsible. But we are quite happy with the presentation. I also had the opportunity this morning to speak to the Premier, who has assured his full cooperation with the Commission's fact-finding mission. He has indicated that the Provincial Executive Council will be meeting today to consider reports from the various departments and on the various interventions relating to this matter. This matter is receiving his priority. He has visited this hospital on several occasions. I would like to give an opportunity now to my colleagues. Through the facilitator, he will indicate who will come first, just to recount what they shared with the Commission during our session earlier today. I thank you.
Thank you very much, Chair, for that reflection. I will then give to the acting DG of the province, Mr. Masebe, just to say what has been the overall response of the Gauteng government since the fire that broke on the 16th of April 2021. Acting DG.
Thank you, Vuyo. Yeah, well, as the Gauteng Provincial Government, I wish to express our appreciation for the interest shown in this matter by the Human Rights Commission. We, of course, work with the Human Rights Commission on a whole range of matters. They produce reports, and we always act on the reports that they produce. Whatever they direct us to do, we will do. So we really appreciate their interest on this matter. As the Gauteng Provincial Government, you know that when we closed this hospital on the 17th of April, the Premier actually thought we could reopen it within 7 days after the closure. And as you know, the closure was occasioned by the fire that broke out in one of the blocks of the building. We had to close the hospital so for the safety of both the patients and the staff. And obviously so that we can also attend to the damage that was caused by the fire. Our estimated time at that then was that it would take us about 7 days to get the hospital back into service. But obviously, once we assessed the damage to the actual building where the fire broke out, as well as the impact of the fire on the other parts of the hospital which were not damaged by fire, it was clear that a bit of time would be required to get the hospital back into service. As you know, fire gets affected by a number of things, wind and the air conditioning system, so smoke did travel to other parts of the hospital. And we needed to, as part of bringing it back into service, we needed to attend to all of those issues, and of course all regulatory issues, including compliance with the national building regulations, as well as the bylaws of the city of Johannesburg. So we've been attending to all of that work, but the good news is that a portion of the hospital, especially the building that serves the oncology services, will now be able to open. We've done work, or we're currently doing work, which will be completed in the next few days. And our plan is that once all that work is completed and the necessary approvals are received from the city of Johannesburg, we will open the oncology building. The target is this week.
Those were scenes from the Charlotte Maxeke Hospital following the fire that recently took place there. We're going to take a quick break.